And we're gonna just go through today a sort of high-level overview of this year's CoC program competition, NOFO, and hopefully my dog who's wandering around doesn't go crazy and bark at some point, but if he does, apologies. So again, my firm, Diana T. Myers and Associates, we provide consulting services to the Delaware CoC and a few other CoCs throughout the country. And so we spend a lot of time getting to know the NOFO each time it comes out, and are happy to take questions as we go along. We're going to keep it pretty high level, but if you have more specific questions, feel free to ask them. The agenda for today, again, is just a high-level overview. Then we'll talk through some of the key changes from the prior year's NOFO. We'll talk about HUD's policy priorities as they're outlined in this year's CoC program NOFO. Talk through some information about funding and tiering. And then we'll get into scoring of the CoC level application. I have just some very brief updates on stuff related to project applications. And then we should have time for Q&A if you have any lingering questions as we go along. But we also have breaks throughout for questions. Feel free to type questions into the chat box as well. So we'll get started with our high-level CoC program NOFO overview, and I'm going to talk through stuff at a really high level and then get into it a little bit more specificity. But to start off super high level, just to explain HUD's Continuum of Care program, that's CoC stands for Continuum of Care, is one of the main sources of federal funding to specifically address homelessness in local communities throughout the country. The other that you might be familiar with is HUD's Emergency Solutions Grant Program, ESG. But the two programs together really meant to complement one another. The CoC program focuses more on housing and longer term, medium term housing options, whereas the ESG program focuses more on crisis response. Congress appropriates funds to HUD each year for the CoC program. And in turn, HUD releases a CoC program Notice of Funding Opportunity, and that's what NOFO stands for, Notice of Funding Opportunity, each year to determine how those CoC program funds are going to be distributed. And part of the reason why they operate that way is that they are required to run the CoC program as a competition on their side. HUD is required to distribute those funds competitively. Unlike some of the other HUD programs that you might be familiar with, they operate more on a sort of formula grant basis, and communities are going to get a set amount no matter what. The CoC program does not work that way. Instead, each CoC is eligible to apply for a maximum amount of funds, but only a portion of the funds are guaranteed in any given year. And they tell us how much through the CoC program NOFO, and the rest we will be competing for. Sometimes HUD makes bonus, what is called quote unquote bonus funds available for that, and that really provides the opportunity for CoCs to bring additional funds back to the community. But again, this is all, it's all a competition. So when HUD issues the CoC program NOFO, the CoC must submit an application to receive funding. Again, this is not a formula grant situation where we're automatically going to get funds. In order to tap into those CoC program funds, each CoC has to fill out an application and apply for those funds. And we'll talk about the parts of that application. The collaborative applicant is the entity responsible for submitting the application on behalf of the CoC. And your collaborative applicant is Housing Alliance Delaware. As part of the CoC program NOFO competition, the CoC will submit a CoC level application along with renewal project applications and new project applications. Renewal project applications are applications from existing grantees that wish to renew their funds. And the new project applications are Some might be a mix of existing grantees, but they are for new activities. Each CoC determines which project applications it's going to submit for CoC program funding by running a local competition. So there's this sort of national competition, right, that HUD's requiring, and then they pass it along to CoCs to make the determination based on a local competition about what projects they want considered for funding by HUD. And then after submission of all the application materials, HUD's going to review all the CoC level applications and score them. So if you're more of a visual person, this is kind of a way of looking at it. We have what's called the consolidated application. It has these two main parts, one being the CoC application, which includes an application and a series of attachments. We're basically showing HUD that we did things the way they wanted. And then a CoC priority list. And the priority list is the mechanism that we use to submit all the project applications to HUD. And the priority list will also include a ranking of all those project applications in the order that the CoC wants them funded. The CoC level application is completed again by the collaborative applicant. It has a lot of questions that are primarily geared toward what is happening in your local system. They want to know about the CoC's governance structure, coordination with other systems, overall performance, strategic planning efforts, all kinds of stuff. I think it's somewhere between 50 and 60 different questions related to all these different topics. Though this part of the application does get scored by HUD, and that scoring is a huge factor in determining how many projects you're going to get funded of the projects that are not safe. Project applications are completed by all the renewal project applicants and the new project applicants. These are the applications where you basically say, here are all the amazing things I'm going to do with this funding that HUD's going to give us. We're going to, for example, run a PSH project. We're going to serve 10 households. We want funding for supportive services and for rental assistance, right? That's the kind of detail that goes into the project applications. The renewal project applicants and new project applicants, again, have to apply through the local communities competition and be accepted by the CoC for inclusion on that priority list, which we'll talk about in a second. And if accepted, they'll go through the process of completing an application in HUD's system, which is called eSNAPS. The priority listing, again, is completed by the collaborative applicant. That's going to be the list that has all the applications, project applications attached to it. And the CoC is, I want to say forced, but HUD requires CoCs to rank every project except for what's called the planning project. And that's a project that is a special project where HUD provides funds to operate the CoC essentially. So that one is non-competitive, but everything else for your CoC is competitive. And all those projects, other projects have to be ranked. This is also through the priority list where you communicate to HUD how much money you're applying for, and that will include telling HUD if you're going to be reallocating any funds from an existing project to put to a new use. So the priority list is kind of the mechanism to provide all of that information to HUD. So prior to submitting the CoC's application to HUD, and we talked about this a little bit, the CoC has to facilitate a local funding competition, and that competition includes the evaluation of renewal projects and their performance to determine which ones should be submitted to HUD for funding and how they will be ranked. So how those projects are evaluated and scored is going to be a pretty significant factor in determining the final ranking. Also part of the local competition is soliciting and selecting new projects. So this year there is actually a lot of money available for new projects. So that has to be a part of the competition. You can also add any funds that are reallocated. Again, reallocations when you take funds from an existing renewal project and put towards the new projects, right? So that would be part of the soliciting and selection of the new projects. And HUD provides guidelines to us through the CoC NOFO each year to say, if we want you to run a local competition, and here are some of the ways, things that we want you to consider, some of the ways that we expect you to communicate with those who are applying for funds and the timelines for doing that. So they provide some guardrails on that competition and incentives to CoCs to run a fair, transparent, open process. In terms of this, how HUD kind of makes the decision around what projects are going to be funded and what aren't, they use a two-tiered system when awarding funds. So tier 1 is the amount of money that HUD will basically put aside as safe for your CoC, right? So they're going to say to you, through the CoC competition, it's a percentage of the amount of money that you already have. And they're going to tell you, well, a certain percent is going to be safe this year, and a certain amount is not safe. So tier 1 is the safe amount, and tier 2 is the competitive amount. And all CoCs nationally, all the projects that are in tier 2 sort of get thrown into the mix to determine which ones are going to be funded. And HUD uses a special formula for this. It has nothing to do with the quality of those projects. The HUD has really delegated the work to figuring out which projects are the highest quality and should be funded to the CoCs, right? And that's part of the whole ranking process. The CoCs have to rank the projects based on which ones you think are the best, or the most needed, or the most compelling for your CoC. So again, once the CoC evaluates and selects all those projects, both renewal and new, they all have to be ranked. So if you had 50 projects, you'd be ranking them from 1 all the way down to 50. And you're going to use sort of your local priorities as well as a guide for this. So this CoC has a set of funding policies, and that outlines sort of the prioritization for the ranking of projects. So that's going to be the guide for that decision making. Once the CoC completes its ranking, inevitably some projects will be in tier 2, and so they will be at risk. Are there any questions about that before I move on to the next section? Okay. Let's talk through some key changes, and we have a really exciting change for this year. A 2-year CoC program NOFO has finally been authorized by Congress. So Congress allowed HUD to issue a 2-year NOFO this year. We're all super jazzed about this because it means that the CoC doesn't have to spend so many of its resources just doing this competition and responding to the application, can focus on some other things in the quote unquote off year. We'll talk about what this means for all of you. So what does the CoC have to submit this year? So the CoC has to submit one CoC level application that will be applicable to both FY 2024 and FY 2025. And when we use those FY 2024 and FY 2025, that's really referring to the sort of federal funding year, right? So again, one CoC level application that's going to apply to both years. And then on the project application side, the CoC is going to submit project applications for new projects and then for renewal projects. And the renewal projects, the ones that will get submitted, are the ones that are due to expire in calendar 2025. So if you were awarded funds last year and your expiration date for your that FY23 grant is in 2025, then you are going to be up for renewal through this year's competition. We also have to submit the priority listing. So again, required to rank all the projects. The deadline for all of that is October 30th of this year. Now, HUD through the NOFO has already told us what they expect us to have to submit next year. So good news, we have plenty of forewarning here. And what will be submitted next year is any renewal project that wasn't funded through the FY 2024 competition, which is this year's competition, and has an expiration date in 2026. So here's a scenario where this might have happened for you, right? You had a grant, you needed an extension, you were granted an extension by HUD, and now it doesn't expire until 2026. You would not submit your renewal project this year, but you would submit it in the FY 2025 competition. So that's how that would work. Otherwise, generally speaking, renewals will not have to be submitted again next year. New projects, however, there will be an option to submit new projects from funds that are reallocated. And if HUD has bonus funds available, the CoC will be able to submit new projects using bonus funds. If bonus funding is available, HUD will require CoCs to have a priority listing because they need to know sort of what your preferences in terms of, you know, how these get funded. It's a competition again, and not everything might they might not have enough money to fund everything. So all of that will be due in August 29th, 2025. So we already know the date for that, which is great. So what does this mean for all the project applicants out there? Again, if your existing grant expires, sorry, the typo there, in calendar year 2025, you only need to submit your renewal application this year. And HUD has said their intent is to automatically renew everything next year. So that means you don't have to go through the process of completing a renewal project application again. If your grant does not expire in 2025, or if you have a new project that is going to be awarded for the first time, you would need to work on submitting a renewal application in the 2025 competition. So new projects, again, there may not be an opportunity in 2025, so just keep that in mind. It really depends on whether the CoC is going to reallocate funds and whether HUD makes bonus funds available. Some other key changes, again, just noting that this year's date is typically we're working against a date in late September, but the due date is late October this year. So you might be hearing from the CoC more in September and October than you're used to. So just keep that in mind. Tier 1, which is the safe amount, this year has been set at 90% of what's called the annual renewal demand. The annual renewal demand is the amount of money that it takes to renew all of your existing projects. So basically, we have our pot of funds that were awarded last year through last year's competition. We get to automatically keep 90% of that, which is nice, but last year it was 93%, right? So there are a lot more funds in that competitive at-risk category this year than there were in prior years, for sure. A larger amount is also available this year for CoC bonus and DB bonus funding. So in general, we feel like it's just going to be more competitive this year. There's a lot more money out there to bring back to the CoC, but there's also sort of more risk, right? So I kind of characterize it as a high risk, high reward situation. If your CoC does really well, you can bring a lot of money back to the CoC. If your CoC doesn't do as well, you could potentially lose a lot of funding. Some of the other exciting changes is a cost of living adjustment for supportive services activities. So this is the first time HUD has been authorized within the CoC program competition to apply a cost of living adjustment to supportive services activities and other staffing focused budget line items, budget lines, I should say, in renewals to help offset sort of increasing costs. We all know we live in the real world. Some of you have grants that have been around for quite a long time and you've never seen an increase in your supportive service dollars, for example, because HUD has never been allowed to increase those. They are allowed to do that this year. So super exciting. The thing to know is that this is going to be applied upon award slash selection by HUD. There's nothing renewal project applicants have to do as part of their renewal project application to adjust your budget for this or anything like that. There's nothing the CoC has to do. The funds will be awarded to the projects, just sort of like HUD adjusts for FMR increases and things like that. So it will just sort of automatically flow into your grant amount upon award. So if you're selected for funding by HUD, you'll get a notification. It'll tell you how much you've been awarded, and that will include this supportive services COLA. Another change this year is that HUD has said that, well, actually Congress said that DV bonus funds have to stay basically with projects that will specifically serve survivors. So there was kind of a little bit of a loophole where DV bonus funds could be reallocated and put to projects that would not necessarily serve survivors. And Congress has gone back and closed that loophole and said, no, if you have a DV bonus project, it's fine if the CoC feels the need to reallocate funds, but they have to continue to serve DV survivors. Any questions on that? Either the 2-year NOFO, the COLA stuff, anything that folks had questions about? Okay, I'm going to keep moving forward. All right, policy priorities. HUD outlines a series of policy priorities in the NOFO every time they issue the NOFO. I think a few years ago, it was maybe a list of 4. It has grown. But the only new one from last year is this number 9, building an effective workforce. I'm going to briefly touch on these, but not go into extraordinary detail. But just be aware that this is HUD saying to us, CoCs as a whole, like, here are the things that we think are really important that we hope you're working on at the local level, and that really are going to be reflected in the CoC application and the questions that we ask the CoC, and you're going to kind of, CoCs, be expected to be working on these things. So first off the bat is ending homelessness for all persons. What does this mean? It really, from HUD's perspective, is a lot about identifying, engaging, and effectively serving people. They want to know that you're sort of partnering with other systems in your community to both expand housing options and services for folks who need it, and that you're really identifying folks who need the services and housing that you offer, and connecting with them and getting them into housing and tailoring what you have to meet their needs. Using a housing first approach, I know that the CoC has spent a bit of time really digging into housing first over the last couple of years. So this remains a top priority for HUD. Again, Housing First really prioritizes getting people into housing quickly, housing as a platform for improving a person's health and well-being, and not having a lot of preconditions, offering housing in a low barrier approach, and really engaging with folks in the community to try to get people into housing, and again, reducing those barriers. HUD is also really encouraging CoCs to assess how well the providers in your community are adhering to the Housing First model and fidelity to Housing First. And so that is something that's probably going to be emphasized more over the coming years. Reducing unsheltered homelessness. So this one, obviously, we know that there are lots of communities that are experiencing a rise in unsheltered homelessness very specifically. So HUD has called out again that we need to make sure that we're identifying all the available resources that we can to bring folks from an unsheltered location to a housed situation, and also working to avoid practices that criminalize homelessness. And that CoCs should be really leveraging your coordinated entry process to get folks into housing, emphasizing participant choice, all of those sorts of good things, connecting people with services, benefits, things like that. Improving system performance is the 4th one. And this is really about CoCs don't forget to keep an eye on how well you are doing as a system in improving on specific measures that HUD looks at. Those are things like the average length of time homeless, folks spend, rates of returns to homelessness, whether folks are exiting to permanent housing destinations, are they increasing their income, are you reducing first-time homelessness in your community? So they really want to know, CoCs, that you are keeping an eye on how well you're doing on those fronts, so that you can assess if you need to make changes in your approaches that will be more effective. Partnering with housing, health, and service agencies remains a top priority as well. We'll see this in the application, the CoC application itself. But really what HUD is saying is that it's not enough to operate as a silo within the homeless system. We really need for all of us, right, to work together, for CoCs to engage with partners throughout the community in this work. And that includes our health care partners, housing partners like PHAs and other housing developers, partnering with local workforce development centers and other systems that engage with folks who are experiencing homelessness. Racial equity, racial equity. In nearly every community, HUD acknowledges Black, Indigenous, and other people of color are substantially overrepresented in the homeless population. And due to this, HUD is really saying, hey, CoCs, we need you to pay attention to this. And we really need you to take steps to identify if there are inequities that are happening related to race and ethnicity, and to working to identify barriers and to reduce those barriers and eliminate those barriers. So part of that effort would be engaging with others in your community who have experience in serving underserved populations and really engaging with them and bringing them into your system planning process. Similarly, improving assistance to LGBTQ+ individuals, again, making sure that, that you're eliminating wherever possible discrimination on the basis of gender identity or sexual orientation within your system, and addressing the needs of LGBTQ+ folks. And making sure that on the project level, there is paid attention to privacy, respect, safety, access, regardless of gender identity or sexual orientation, and partnering with organizations within your entire system who have expertise in serving those populations. When it comes to persons with lived experience and expertise, HUD is really focused on this and pushing CoCs to really engage with people with lived experience and expertise to identify effective solutions right within your systems. So they want to see that CoCs are including people with lived experience and expertise in your local planning and decision-making process, and not sort of tokenizing those folks, but really bringing them fully into all parts of your CoC planning process, and hiring them and compensating them appropriately. Building an effective workforce. So this is the new one. HUD has really, I think, heard the complaints over the last few years that the workforce of those who day in and day out, a lot of those who are doing direct service provision, right? This is hard work, often for low pay. So we saw in the COLA increase, right? This push to try to increase the amount of funding that's going to the workforce, so that projects and agencies can effectively recruit and retain qualified staff. But we also know, like, this is a sort of bigger than just one COLA increase, right? We need to work together to identify sources of funding to be able to adequately support the workforce and pay them, but also provide other kinds of support. Increasing affordable housing supply is the last one. And this is really HUD saying, hey, you know, those of you who are in the homeless system, we acknowledge, right, that the core issue for many of our folks who are experiencing homelessness is a lack of affordable housing in our communities. And as such, we want CoCs to play a role in educating local leaders, stakeholders in your community around the need for housing for the people that you serve day in and day out. And that includes working with local leaders to take really proactive steps around things like reforming land use or zoning laws, right? Things that will concretely move affordable housing efforts forward. Any questions on those? There are a lot of them. They do dovetail, I think, a lot with the CoC's own priorities, which are posted on the CoC's website. But any questions on any of that before we move forward? Okay. So let's talk briefly about funding and tiering information from this year's CoC NOFO. So again, I mentioned this before, that tier 1, which is the safe amount for this year of our HUD funds. Oh, okay. Norma, did you have a question?
Yes, I do have a question. My question is because of you went through all the different, I guess, ways you can look at the funding. My question is, are organizations that may help someone that experiences homelessness to build back up their credit, could they be considered from funding through this program or through this opportunity?
Really, this opportunity, the CoC program funds very specific types of projects, and that it's really focused around housing. So
Housing, okay.
yeah, it's primarily things like rapid rehousing, if you've heard of that, permanent supportive housing. If your organization is focused more on the like supportive services, then you might want to connect with an agency that receives CoC program funding to see if you can be a partner with them. But unless you're really invested in, the provision of housing, this is not an easy funding source for folks to use, organizations who aren't going to deliver housing themselves. Does that make sense?
Yes. Yes. And I have one more question. Do they also consider programs that provide vaccine or help people that are uninsured or underinsured with medical attention? Would they be eligible to apply for this opportunity?
So again, it's pretty similar to like the things that you can find. I think Erin posted in the chat the eligible applicants and projects. But if you're not really delivering like a housing model, the CoC program funds are not going to be the best fit. But it would be great for you to connect with agencies that are operating those CoC programs, because there's probably some great connection there that could happen in terms of maybe they have some resources to help you and vice versa, right? But just being an applicant, there's not really an opportunity for folks to apply just for things like that. Traditionally, CoC program projects are providing case management to project participants and connecting them to housing and helping to support them in their housing. And so that's the primary sort of activities that get funded under the CoC program.
Thank you.
Okay, so I'm going to talk a little bit about the way funds are going to be distributed. So tier 1, again, 90% of the amount that's available is going to be safe this year. And tier 2 is, there's a sort of long definition here, right? The difference between tier 1 and maximum amount. But basically you take what's left of your ARD and you add in the bonus funds available, and that's what tier 2 will be. So I will show you the sort of amounts in a minute. The CoC bonus this year is 12% of something called the final pro rata need. That's the higher of the annual renewal demand and the preliminary pro rata need. And I often say if HUD could make this more complicated, they probably would figure out how to do so, but all these acronyms are a little crazy. The preliminary pro rata need is basically a formula that gets used with CDBG funding. And it's based on sort of your per capita like population within your CoC. The bottom line is for your CoC, your annual renewal demand is higher than the PPRN, and that is what will be the basis of your CoC bonus. And all this translates into a set amount of dollars, and we'll talk about that in the next couple of slides. In addition, HUD has money specifically for projects that will serve survivors of domestic violence. And so that's 15% of the PPRN is the formula for that DB bonus funding. Now, tier 2 projects, those that are competitively funded, have it's their own sort of scoring rubric applied to them. And up to 50 points are going to come from the sort of proportionally from the CoC's application score. So you as a community really want the CoC to put together the best application they possibly can, because that will mean there's more money coming back to the CoC. The rest of the scoring for the tier 2 projects, there's 10 points for commitment to housing first. And then there's 40 points for basically how high the project is ranked within tier 2. So the higher your project is in your CoC's tier 2 sort of ranking, the more points it's going to accrue, the more competitive it will be, the more likely it will be to get funded. Tier 2 projects, the HUD has no rules within the CoC NOFO around what projects go into tier 2. So it's typically a mix of renewals and new projects. And those new projects can come from reallocation or CoC bonus or DB bonus. So really tier 2, some folks are kind of in the mindset like, oh, you can only put new projects into tier 2. And it's like, nope, it can be a mix. And then the NOFO specifies that this tier 2 funding approach, as much as we all who have to do it hate it, it is a mechanism really to force CoCs to prioritize based on local needs and gaps. And so, yeah, I would say it's not fun, but it is effective. The CoC this year can apply for up to 12.4 million, which is exciting. It's a lot of money, so we'll cross our fingers and do all the work to bring home as much as possible. This includes the amounts for ARD, CoC bonus, DV bonus, and CoC planning. I have estimated here because these numbers were still, I got a sort of advanced copy of something called the ARD report that has the numbers in there. It's not official yet. So we're saying they're estimated, but we think these are what the numbers will be. Basically, the CoC's safe amount is about 8.7 million. The CoC bonus, a little over $1 million this year. The DV bonus, again, also a little over $1 million. And then the CoC will get a planning grant of around $480,000 for the FY24 cycle. Any questions on sort of those funding levels and anything about the funding process? Okay. So let's talk a little bit about how the CoC level application is scored. I'm going to try not to belabor it too much, but it is important for stakeholders to understand sort of why you all want to work together to do the best you can, because ultimately it impacts the funds that you'll be able to bring home. The scoring of the CoC level application has not changed very much in the last 3 or so cycles. Prior to that, there were some more shifts happening, things pre-COVID and then coming out of COVID. But since 2022, you can see there's been very little change overall in sort of the emphasis for the scoring and what parts of the application HUD is putting more points toward. So the CoC coordination and engagement section is worth 84 points, the bulk, and then we have system performance at 60. And then we have this project ranking, review, and capacity section at 28 this year. There's some other sections. We'll talk through these and I'll highlight just some important things to note. On CoC coordination and engagement, again, they want to know that CoCs are coordinating with other systems of care. That's a big part of this. And including sources of funding other than the CoC program. So they want to see that you're bringing in units from, say, PHAs, right, into your system. An inclusive and outcome-oriented community process is also really important. They ask a lot of questions about governance and also who is involved in your CoC and how the CoC engages with members of the community to bring them into the CoC. So that's very important to HUD. They want to know you have a fair and impartial review and selection process and that you are building up your inventory of housing dedicated to folks who are exiting homelessness. In terms of the rating factors, there are a lot of them in this section. Some are worth more points and some are worth a little bit less. The high value ones are engagement with public housing authorities and housing first. So don't be surprised if you hear the CoC pushing on things like that, right? Because these are clearly getting the message from HUD. You should be working with your PHAs to identify units. You should be incorporating housing first into your approach and operating with fidelity to the model. The other things, they want to always see an increase in rapid rehousing beds from year over year. So that's worth a lot of points. And then we have other things like inclusive structure and participation and addressing the needs of DV survivors, addressing the needs of LGBTQ+ individuals, your coordinated entry system and how it engages with folks, and affirmatively furthering fair housing, partnerships with public health agencies, advancing racial equity. These are all things that put together, right? If you do well, you're going to score highly on your application, but it can be sort of a situation where it's, I call it death by 1,000 paper cuts. You can lose points here and there and here and there, and then your CoC is far less competitive. So the gist of it is you want to be doing well on all of these things, collaborating with all of these systems, supporting all of these subpopulations that the best you possibly can. In terms of project capacity review and ranking, this is really about how your CoC runs that local competition for your renewal projects and your new projects. So there's up to 28 points, and really what they want to see is that you have a fair and transparent process. It's data driven, that you're using objective criteria, system performance related criteria. You are engaging with DV providers for data from their comparable database. You're looking at how rapidly the projects are going to get folks into housing. You're going to incorporate some attention to the fact that some projects serve folks with really high barriers, right? You're working to advance racial equity in your local CoC competition process. They also want to see a willingness of CoCs to reallocate funds. You at least have to have a process if you aren't reallocating a certain percentage of funds, and they want you to sort of explain why you did not choose to reallocate funds in any given year. And then the ranking and selection process, they just want to make sure that the CoCs are notifying all the project applicants in a timely manner, making sure that you have access to apply for funds. So that's part of that. In terms of objective criteria, they want to see at least 33% of the total points awarded through the application process to be for objective criteria, and then system performance criteria, they want to see at least 20%. And this is primarily for our renewal project applicants. Those of you who've gone through the process, you're familiar with this, but we are trying to always meet those thresholds. HMIS points are typically this is like a shrinking. This used to be far more in terms of point value, but it's been shrinking. What they want to see is the CoC submitted the required reports, like the housing inventory count and the longitudinal systems analysis reports. They want to know that the CoC is really working to get as many of those out there who are serving homeless folks experiencing homelessness, through different programs are participating in HMIS. So that's what the bed coverage rate is about. And then they want to know that DV providers are using a comparable database and able to provide data to the CoC. Point in time count, this is all about submission of the point in time count data on time and effectively counting youth. So have you, as part of your point in time count, engaged with youth, brought them into the process, because they really want you to be able to identify youth through the point in time count, and that can be especially hard with youth. For system performance, it's really focused on the key system performance measures, and HUD, this section's worth a lot of points, and really what they do is they look at data from what's called the System Performance Measures Report from last year and then this year, and everywhere where your CoC did better, you'll earn points, and if you did worse, you will lose points. So that's the gist of that, but they do allow you the opportunity to talk about the strategies that you're using to improve year over year in these different areas. So, you know, the CoC is always going to be working on, I think, trying to make improvements year over year in these areas, things like length of time homeless, a successful placement in permanent housing, right? And just reducing the overall number of people experiencing homelessness in your community. Those are weighted very heavily in this section. And then we have returns to homelessness, which we of course want to reduce, and jobs and income growth, which we want to increase. Those are worth a little bit less points, but still important. Coordination with housing and healthcare sounds sort of like, oh, the CoC coordinates with housing and healthcare agencies. This is something we should get the points on, except that really what this is tied to is projects, new projects, and they have to be housing projects. So permanent supportive housing, rapid rehousing, or joint transitional housing and rapid rehousing projects that are bringing a leverage from a housing and or healthcare partner that is not CoC funded or ESG funded. So they're bringing a leverage of those resources to the project, to the CoC. So for the housing part, they just want to know that you're leveraging housing resources. Again, not CoC or ESG funded. And then the healthcare part, they want to see projects, the CoC submit projects that will leverage healthcare resources. That can be substance use treatment or recovery. It can be other healthcare related resources, but they don't want to necessarily use CoC dollars to pay for this, right? They want to leverage other resources that are out there in the community and bring them to these projects. So any questions on any of that, on the scoring of the CoC level application? Okay. I have some very brief project application updates. So the Delaware CoC issued a notice of intent in the spring, and then the new project request for proposals was issued on July 23rd, and proposals were due actually last week, which was August 16th, for everything but the DV bonus coordinated entry, essentially opportunity. So that one is still open until till tomorrow, but that's a very highly specific thing. If you are not an agency who is familiar with operating or working within coordinated entry and serving survivors, not the opportunity maybe for you, but it is still open. The funding committee will be reviewing and selecting projects for funding consideration in the next couple of weeks. And applicants selected to move on will be asked to complete and submit new project applications in eSNAPs, and a DMA will provide a training to anybody who is selected for that opportunity and who needs just maybe some pointers on how to properly complete the application in eSNAPs. On the renewal project side, the Delaware CoC will request and conduct a review of all eSNAPs renewal project applications, and HAD staff will be assisting applicants with this project. So you'll be hearing from them if you have not yet already. And then on the ranking side of things, because all of the projects have to be ranked still, the CoC's funding committee will meet to discuss ranking options, and ultimately they will be making a recommendation to the non-conflicted members of your board regarding a preferred ranking. The non-conflicted board will meet and review those recommendations. They'll be the ones to decide on the final ranking list and approve that. And once that final ranking has been approved, the CoC will notify all the applicants about their inclusion and ranking. If you have any questions about this year's CoC competition, you can contact Erin, who will have the great joy of responding to all the questions, not me. Yay. Hopefully we've just provided an overview of the CoC competition in general. But happy to take questions now, or you can follow up with Erin separately. All right, Erin, did you have any last words for the group today?
Just thanks everybody for joining us and learning about the CoC funding application. I know that it is the most thrilling and engaging content in the entire world. We
Absolutely.
should have all of the materials processed and posted between now and Monday. So the recording will be available on the website as well as the slides.
Well, thanks everybody. Hopefully I didn't put anybody to sleep, but if you really needed a nap, then, I'm glad I could provide that service. And wishing everybody a great rest of your day, and hopefully a happy Friday and good weekend.